Hi there. Today we are going to talk about psoriasis. Specifically about the targeted treatment approach of IL-17, on patients of gain-of-function mutation of CARD14. The members of these team are Carmen, Naomi, Gonzalo, Juan, and Curtis. Let's start. Psoriasis is a chronic inflammatory skin disease with a strong genetic predisposition and autoimmune pathogenic traits. The worldwide prevalence of this disease is approximately 2% with variations in different regions. The hallmark of psoriasis is sustained inflammation that leads to uncontrolled keratinocyte proliferation and dysfunctional differentiation. The typical histologic imaging is the prominent neovascularization and epidermal hyperplasia. This is with the overlying inflammatory infiltrates composed of dermal dendritic cells, macrophages, T cells, and neutrophils. The main clinical findings are skin manifestations on the epidermis. However, psoriatic plaques can also span the dermal layer as well. Psoriasis is categorized into two phases. First, the initiation phase, possibly triggered by trauma, infection, or drugs. The second category is the maintenance phase, which is characterized by a chronic progression which involves immune processes with production of cytokines, such as IL-12, IL-23, and the newest identified cytokine involved, IL-17. Let me talk to you about the mutation of CARD14. Recently, the mutation of the caspase recruitment domain, family member 14 gene, was identified in patients suffering from psoriasis. The regulation of NF-kappa-beta activation is mediated by the scaffolding protein CARD14, and the enhanced activity of NF-kappa-beta, caused by CARD14 mutation, leads to inflammatory transcription in keratinocytes including CXCL8, CCL20, IL-36G, IL-8 and IL-6. The release of those chemokines are implicated in the pathogenesis of psoriasis, such as IL-8 and CCL20 leads to the recruitment of neutrophils and activation of dendritic cell, which produce IL-23 critical for the development of Th17. The Th17 cells produce IL-17 and IL-22, which leads to the activation of keratinocytes and epidermal hyperplasia. The role of IL-17 in psoriasis. The psoriatic lesions contain near normal expression of IL-12, but elevated levels of IL-23 that has a role in the maintenance of a third subset of T helper cells, Th17. These cells are defined by their ability to secrete IL-17 and are now known to play a critical role in psoriasis. IL-23 that is a master regulator of the Th17 pathway and is needed for both proliferation and survival of Th17 cells. The cytokines IL-17, IL-17 and IL-17F are most relevant to the pathogenesis of psoriasis since they act on keratinocytes and are elevated within psoriatic lesions. IL-17A is thought to augment keratinocyte gene expression of defensins and cathelicidins, which are involved in the innate immune response.
Some of the functions of this cytokine is also recruit and activate neutrophils, inhibit neutrophil apoptosis, and increase the angiogenesis. IL-17A acts synergistically with TNF-alpha to augment the keratinocyte response to inflammatory cytokines. IL-17F is found to induce the production of IL-6 in normal human epidermal keratinocytes, which is considered to be an objective measure of inflammation and is elevated in psoriasis lesions. Different types of tests are available to identify CARD14 gene mutations, such as the bidirectional Sanger sequence analysis or next-generation sequencing, the CARD14 single gene test, and the primary immunodeficiency panel. For patients with moderate psoriasis, the topical therapy could be indicated in association with systemic treatment. Another treatment is based on specific monoclonal antibodies inhibitors of IL-12, IL-17, and IL-23.
In our extensive search, we found articles related to the specific mutation of CARD14 in patients with psoriasis and specific treatments that have good results with the inhibitions of some cytokines involved in the pathogenesis of this disease. One of those cytokines is the IL-17, as we mentioned and explained earlier, that have an important role in the pathophysiology of psoriasis. Recently, biologic therapy has expanded beyond TNF-alpha inhibitors to targeting antibodies. have demonstrated increased efficacy in clinical trials. The research of clinical and genetic heterogeneity of CARD14 mutations in psoriatic skin disease explain the physiological role of CARD14 in mouse psoriasis models. Findings in mouse models suggest that targeting the IL-23, IL-17 axis and IL-17A would be beneficial for patients with this specific mutation. 3 biologic drugs that target IL-17 signaling are currently being tested for the treatment of psoriasis in clinical trials. Brodalumab, ixekizumab, and secukinumab. This is the mechanism of action of these biologic drugs. As a future physicians, it is important to have in mind that CARD14 mutation is a possible cause of psoriasis. The identification of this mutation is relevant because it gives us a better knowledge of this condition pathophysiology and the appropriate treatment. Targeting the IL-23, IL-17 axis and IL-17A with monoclonal antibodies such as brodalumab, ixekizumab and or secukinumab can be used as a possible treatment for CARD14 mutation patients. However, this treatment is not specific, and more investigation has to be done. Looking forward, genetic therapy could provide a better outcome on CARD14 mutation psoriasis patients. Thank you for your attention.